Hello and welcome to our Google Hangout. Thank you for joining us on this discussion of the role of local news and information as the Ebola crisis unfolds. At Internews, we believe that during a public health emergency like this one, people need quick, free, and reliable access to information about the disease and how to prevent it. They need to know how to identify early symptoms, prevent transmission, what to do and where to go if they are infected, among others. And thanks to our rapid response donors, Internews is now on the ground in West Africa, responding to the information needs of the population. So we'll be hearing about this response from our staff today, and I'm glad to be joined by Ian Noble, who is our Director of Sub-Saharan Africa, Alison Campbell, who is Internews' Senior Director of Global Initiatives, and Matthew Jacob, who is our Program Officer for Africa Programs. So thank you again for joining us. And before I pass this discussion over to Alison, I just want to mention to you all watching that we encourage you to participate in this discussion. So if you have any questions for our presenters or for Internews in general, please feel free to post those questions on the events page, and we will try to get to them during the discussion, and if we don't, we will certainly get to them in the Q&A. And along those same lines, if you just have any general comments or want to introduce yourself on the events page, please feel free to do so. So thank you again for joining us. I am going to pass this off to Alison. Thanks so much.
Thanks, Amanda. Hi, everybody. I'm Alison Campbell. I'm the Senior Director for Global Initiatives. Global Initiatives are a number of portfolios, including humanitarian emergency response and health. And so busy times in my department right now with this enormous collision of health and humanitarian emergency in West Africa. I think perhaps one of the most interesting aspects of this particular emergency, which is being widely recognized by everybody now, is the extent to which information or the lack of information is actually a very key central factor in at the heart of the emergency itself. For Internews, we understand very well and have always operated on the principle in our humanitarian responses to many disasters, the fundamental importance of providing timely, accurate, balanced, well-researched and understood information to people caught up in emergencies and disasters. And I thought that perhaps one of the best ways to get that across in this conversation is to look at, for instance, how attention has been focusing so heavily on Ebola in the last few days in the U.S. since the death of the patient in Texas. I mean, it was on the news radars before that. There's certainly now a huge intensification of awareness across the U.S. and alarm, and you've probably been pinned to your radios and televisions, just as I have, as we probably all have for the last days. And this is an indication of, it's interesting how many misperceptions exist around Ebola, its transmission, and the options for treatment and the options for containment that prevail here in the United States. So, I mean, if you can understand that, and you've been hearing, a range of experts on the air, doctors, medical workers, people from West Africa, people from the US, people from the CDC, and probably amongst your friends and colleagues, you would have these conversations, and it quickly becomes clear that even here, amongst a relatively in a media-rich and relatively well-educated society, how many myths and misunderstandings and contradictory opinions and thoughts can prevail on the matter. So if you think about West Africa, where you have two countries at least emerging from many, many years of deep, dark civil war, very poor health infrastructure, very poor media and communications infrastructure, low literacy rates, trauma, prevalent in the communities, you can just get some idea of the state of mind, that must be prevailing there amongst these communities in these remote parts of West Africa. So then again, if we think about the kind of media and information that we have all been receiving, the public health communication that we have access to here in the US through public radio and through television, parades of experts and different voices, this very sort of wide and rich stream of information that we have access to. This is certainly not the case for those people being affected by the rapidly accelerating crisis in West Africa. We have to consider that the journalists themselves, media workers, as well as health workers, are themselves being directly affected. Their families are being directly affected. And they themselves have really not much more information than people in the general public would have. So whereas journalists in newsrooms here across America have a wide range of resources available to them, and they can go to the CDC and they can talk to medical anthropologists and they can reach people on the ground, and they have a range of voices, they have research, they have the internet. That's by far from being the case in the affected countries in West Africa. So this is the sort of environment where Internews looks to go in and actually shore up and enrich in whatever ways possible the information available to journalists themselves. How do they understand the disease, its progression, treatment options? How do they tell rumor from fact? How do they convey that to their audiences in ways that are interesting, compelling, consistently accurate, and therefore reliable? Because at the end of the day, streams of reliable information are what people need to be able to make decisions about their own behaviors, the options that are available to them, whether they stay, whether they go, and their general health practices. The interesting feature, I think, one of the most interesting features of the information landscape in West Africa and the public health communication that prevails there is the aspect of public service announcements and messages that have been consistently put out by the many health agencies, responders working there, the World Health Organization, Médecins Sans Frontières, multiple agencies, UNICEF and others. And these messages, I mean, we see them on the TV. If you've been watching your TV or you see newspaper pictures, you can see them on the walls behind people. You can see them on billboards. And the airwaves are now relatively saturated with Ebola-related information about not touching the bodies, about sanitation, about hygiene, and all of this sort of stuff. So the region is relatively saturated with public health information in the form of messages, and this is always a very necessary part of any public health response to any emergency. However, Internews' approach is a little bit different. We do seek to enhance the impact of that messaging by contextualizing it in a more what we believe to be a way that is likely to reach people at a more kind of contextualized and hyper-local level. I mean, we also like to consider that media and messaging is one way of reaching people, but there's much to do with trust in the communities as to who they will listen to and what they will believe. And we do hear from people on the ground that they are aware that these messages are coming down from international health agencies who are perhaps not themselves terribly well understood or easily identified by communities on the ground, and not particularly well trusted by them. So very often those same messages need to be transmitted down to communities in different ways, and that would be through the voices of their trusted community members and leaders, perhaps their ministers in the church, teachers, or other trusted information sources in the community. So the challenge here really is to um, is to build around this great prevalence of public health messages a more contextualized environment of voices and stories of local people speaking to local people through trusted networks. And in this, the local media is going to be an enormously important partner, and should be reaching and exchanging information with health providers, with health workers who are very often who are completely on the front line of this emergency. Radio talk show hosts, actually, in many of these countries, have enormous influence and are opening the lines for callers to call in from all over the country. And they also need training as to how to moderate these discussions, how to identify rumors, how to be able to debunk rumors on air as they arise. So this is what we call the information ecosystem of any different country. There are all these many different ways in which people are receiving many different streams of information, and Internews' mission in any of these scenarios is to go in there and really look at how is information reaching people, and where is it appropriate to their needs? Does it have a relevance in their local community? Because what we also know is that even in relatively small countries like Liberia, for instance, what people will be hearing and thinking and believing in remote communities up near the Guinean border is quite different from what people will be hearing and thinking and believing even in the capital or at the other end of the country. So there's a very hyper-local aspect to these mysterious ways in which information moves in and between communities, and to what extent it's actually understood, trusted, and ultimately acted upon. So this is Internews' understanding really of how the importance of hyperlocal information, accurate, engaging, reliable, coming through trusted channels in any given emergency scenario, whether it be in the aftermath of an earthquake or in the midst of a health emergency such as this. So we are right now just mobilizing additional people, as many other agencies are, to get into the region. It's an extremely challenging situation to be dealing with this simultaneous onset in 3 countries. We do have some people on the ground already, and in a minute I'm going to be quiet and hand over to my colleague Ian Noble, who will tell you something about our actual operations on the ground. But I did think that I would mention a couple of the most recently troubling emerging trends, which is the issue of stigma is one. And I think as the emergency has gone on, of course, everybody could see what the information issues, the initial information issues were all about how to prevent, avoid, seek treatment for Ebola, that strict health-related information itself. However, people have a whole range of other information-related needs as the emergency unfolds. And one of the issues which is arising now is that of stigma, the stigmatization of people who have survived the epidemic, and who usually survive the epidemic and come back and find that their homes have been burnt to the ground and all of their belongings have been destroyed for fear of infection. And that stigma extends even to children. So some of you may have heard the very sad story this morning of the baby whose mother died and was left in a box, and the health workers tested the baby, and the baby appeared to be not affected, and they picked it up quite naturally and passed it from hand to hand, and then 12 people were infected. I mean, so I think the issue of children is particularly troubling because it is everybody's instinct to look after them in a natural way, but it isn't possible. And so more and more we are seeing children left untouched, left orphaned. Nobody wants to care for them, nobody will touch them, nobody will take them into their homes and look after them. So these are 2 new aspects that can also be addressed by having the right kind of rich and engaging information flow through these communities, having people able to discuss this issue amongst themselves, not face to face, but through the radio, on call-in shows, etc. So I will. I'll break off there. We can come back to all these different aspects. I'm going to ask Ian to give us a little update, or a little bit of the background actually, as to Internews' history of dealing with the epidemic in West Africa, and a little bit of the where we are now with our on-the-ground operations.
Yeah, thanks, Alison. I'd like to say how the project grew up in West Africa, but maybe first a little bit of what we've done before that Internews has worked on in humanitarian activities in other parts of Africa, and what we've learned from it, because I was very struck once again by what Alison was saying about public service announcements, messaging, which we believe is important, but we have been working in order to have a much broader approach media-wise. And I remember when I was working in South Sudan many years ago, and there was cholera outbreak, and we had these live call-in programs with a medical expert and a presenter, a journalist, that all the public service announcements were saying, wash your hands, wash your hands, wash your hands, which is basically what you have to do. And a caller called in and said, but what happens if we don't have any water? Or what happens if we don't have any clean water? Is it okay for me to wash my hands in the Nile just outside my hut where there's sewage works, and so on? And of course, there are other things you can do. You can wash your hands with ash, for example. But the ability to have an interactive call-in program when people who are getting bombarded with messages can say, hey, I didn't quite understand that, or what about this, what about that? And the issue of trust and local contact, which Alison mentioned, is extremely important. We've worked with humanitarian information in refugee camps for Somali refugees in Kenya, in humanitarian emergencies in Mali, in Chad, and in all of these places we have really also recruited local people to be the people who produced the programs. In Dadaab refugee camp for Somali refugees in Kenya, we built up a team of refugee reporters. They didn't know anything about journalism. We trained them. These were people from the community who were known by the community and trusted by them. And that is an incredibly important way of communicating with people in a way that is trusted. So Internews has been doing these kind of things in my patch is Africa, so that's why I'm giving you African examples, but there are many others at Internews. We started off in February this year a program in Guinea, which was actually about various things. It was about what we call conflict-sensitive journalism training. It was about building capacity for better journalism across the board in order to prevent conflicts being stirred up by bad practices in the media being mostly radio in this particular instance, is the most widely available, widely listened to media in actually most of the countries we're talking about. And as part of that, one of the components of this program was a humanitarian journalism training in Guinea Forestière, which is the part of Guinea which is in the southeast and which borders with Sierra Leone and Liberia, and which is actually where this whole latest outbreak started around about March this year. So we were doing this activity in a town called Nzerekore, which is the main town in Guinea Forestière. We were doing humanitarian information, and the only humanitarian information, the dominant one, which has been happening there for 6 months, has been to inform the local population about what Ebola is, how not to catch it, what to do if you have the symptoms, and all the social, environmental, and human issues around that. So we had been working on that for quite a while. We have a trainer, actually a trainer, an African from Central African Republic, who is very experienced as a trainer in humanitarian information, who is there working with a Guinean trainer and working with local radio stations in the area to work with them on a day-to-day basis to produce programs about humanitarian information. At the core of that, of course, has been Ebola. When the epidemic began to spread because of these very porous borders, which Alison mentioned earlier, moving into what we called at the time the Ebola triangle. There's a triangle which overlaps between these three countries and began to seep into Liberia and Sierra Leone, and then the death toll started to expand dramatically. So at Internews we said, we've been doing this in Guinea, we've been doing it for months. We have the expertise, we have our method of doing things. We could try and that other people in neighboring countries have the benefit of that. We have since done some assessments, we've built up some small activities. Alison can tell you about one particular in Liberia later, but what we're doing right now, and we have put in a number of proposals for funding, which we're very optimistic that we'll get very soon, because the partners that we're talking to recognize that this is a huge need, is to actually replicate, but on a much larger scale, what we have been doing in this corner of the forest in southeastern Guinea, where the outbreak started. So without going into too many details about what it is we're doing, the idea is that we will have a production and training hub in the capital city, whether it's Monrovia or whether it's Freetown, that we will have journalism trainers there. We will have a position which we now like to include in all our projects, which we call a humanitarian media liaison officer, or in this case a health media liaison officer. There is a huge need to coordinate the way the information campaign works in order to get all the health organizations, some of them are international United Nations organizations, international NGOs, the health ministries of the country in question, local NGOs, to get all those people to have the same approach to putting out coherent, consistent messaging. And that's just the messaging. We talked about all the other things you have to do around that, which are actually to do reporting, to tell human stories, to enable people to be interactive with the media in order to ask questions, including stupid questions. Somebody once said there's no such thing as a stupid question. There are only stupid answers. And people in parts of Sierra Leone were saying, oh, can I catch Ebola from a mosquito bite? Or will I not get Ebola if I bathe my feet in salty water? There's actually been a real health problem in Sierra Leone because somebody put out the idea that if you drank lots of salty water, it would protect you from Ebola, which is nonsense. But lots of people are now suffering from hypertension because they've got too much salt in their systems. So but you can tell people what they need to know as much as you like. If you don't have that kind of interaction and that kind of overall approach to information, you're not really, I think, attacking the root of the problem. So this is why the humanitarian or health media liaison officer is a really key position in order to not only get a common consensus of understanding about what the message is, but also how to integrate that into a much broader media strategy for engaging citizens, the community, ordinary people, with this whole information flow. And just a word about that, sometimes health organizations themselves can't agree on the best form of messaging. MSF, Médecins Sans Frontières, put out some messages for Liberia saying, we think you should use these messages. Don't use the ones from the World Health Organization because they're misleading and panic-inducing. And the World Health Organization's one started with a sentence which you have probably heard, which goes something like, Ebola is a highly contagious disease which can kill up to 90% of the people contaminated by it. Well, there's a lot of mystery in that up to 90%. I was just looking at the latest figures, which give a death toll of like 8,400 cases and 4,000 deaths. Of course, the figures are unreliable and there are many more cases and many more deaths, but these are the recorded official figures, and they show more than a 50% survival rate if you get to the hospital fast enough when you've got the symptoms. So there is a whole depth of information and explaining information and understanding it, which goes through that position, the humanitarian media liaison officer, and also the journalism trainers in the capital city who will be working with training other journalists who will be able to go out and work in remoter locations, and also producing a daily newsletter, daily programs, which will actually be like a written and a news agency audio hub for Ebola information throughout the country. That is currently what we're trying to engage in those three key countries, really piggybacking on the first things that we did in Guinea. So I think I've talked enough about how that started and where we got there, but I think Alison has been following this much more closely about some really important things we're doing on a small scale, but very importantly in Liberia.
Yes, that's right. I wanted to tell you a story about one of our local partners in Liberia. But I thought that I would preface that by saying that one of the difficulties for us, and one of the difficulties for many agencies working there, is the business of how much can we actually move around in the community, at this time. Typically, in any given country, even if it's been knocked sideways by an earthquake or a tsunami, Internews spreads out as much as possible and connects with journalists at local radio stations across the countries concerned, and kind of assesses what they need in order to keep themselves on air, and addressing people's information needs as much as possible. This is going to be a tricky one in this case because of the difficulties of engaging face-to-face with communities. It's something that we're going to have to very much assess as we go along. So in terms of how isolated communities can be, I think there may be a lady on this call by the name of Dr. Jodie Yeri, in which case, hi, because we've been doing a lot of talking recently, and she has introduced us to a fantastic gentleman who is in the second largest city in Liberia, which is called Ganta, and it's way up near, very close to the Guinea border, actually pretty much the same part, close in the heart of the affected triangle, the area where we were working in Guinea. He's really not far from the Internews original hub in Guinea. Actually, he's just on the other side of the border. And Aaron is a nurse educator who for several years has had regular radio spots on 2 or 3 local radio stations around Ganta. They reach an audience of 20,000 plus people. And his topic has been really post-conflict trauma and the mental health of those people who were so terribly affected by that very terrible war, which only ended 5 or 6 years ago. And so much as when Ebola struck, our affected communities where we were working in Guinea, and we swung our attention around to address all things Ebola, Aaron Deba did very much the same thing with his already established slot on his radio stations there, and using, most importantly, his trusted, he's a trusted person in his communities. He's very much looked up to, and people are familiar, with his wise words, reaching them on the airwaves every week. And so he was introduced to us, and at the time when we began chatting with him, there was already a lot of responding or information about responding, coming from the international community. We need to do more. We're doing this. The agencies are there. Messaging is available. Well, when you have a conversation with Aaron, you understand that really he is totally on his own in his really not insignificantly sized community. He is one guy with a sidekick, Roosevelt, and 15 outreach workers. He has a motorbike. I think they have a couple of motorbikes. None of them have mobile phones. But he has taken it upon himself. This is not just about his radio show. He does go on air several times a week, and the lines do get open for people to ask him questions. But he also travels around, and he sends his outreach workers around to churches, to schools, to community halls, and to the villages themselves. So the most recent report that we get from him, which is stuff that he's done in the last 2 weeks is that he and 15 people have visited 420 households, 2,800 people, and spoken to them face to face. They take materials with them. They take T-shirts. They stand up in public. They give people the appropriate messages about how to avoid the transmission of Ebola, what to do, etc., etc. And I think that they also and they address rumor. So, I mean, the kinds of rumors we get every week, a new list of the kinds of rumors that are going around, and they are actually, some of them are pervasive, but some of them come and go. There are different ones that are circulating all the time. The business of washing one's hands in chlorinated water, for instance. I mean, he's a medical guy. He understands that this may be a way of keeping one's hands clean, but the population then starts to wash their hands more and more frequently in less and less diluted chlorine. So it starts to eat their skin. And Aaron starts to worry that, in fact, they are making their skin even more fragile and therefore even more vulnerable to the Ebola virus. So there we go, much like Ian's example from South Sudan of the hand washing in clean water, dirty water, or ash. There are so many nuances, to the way that these messages can play out. And if people aren't constantly kind of advised as to which way, to adjust their behaviors, then this kind of thing arises. Ebola is spiritually manipulated. Ebola is a Western plot. If you go into those tents, you will definitely die. The government is trying to propagate Ebola because then it can get lots of money from the West, which it will keep, and it will never come down to us. And some of these stories sound pretty crazy, but when you really think about, again, going back to the example of how wrong people can get it in the West, and even some Western journalists can get it pretty wrong from some of the stuff I've seen recently, you start to understand that these are not necessarily crazy or spooky or uneducated responses. They are actually very natural human responses that arise in absence of information. In absence of information, rumor will prevail. So we are getting, we have received already generous donations through Global Giving. Those of you who are with us who have already donated in that way, I'm really happy to be able to tell you that that money is now actually in Aaron's hands and he is using it, and we will be sending more along to him. He needs, for instance, something as simple as a motorbike. I mean, he can rent a motorbike in his community, but if he rents different bikes, they may be infected, and it ups the risk of his infection. He's a man living with his wife, and he has a small boy, and he lives in the compound of the Methodist Church. He needs a phone. His people all need phones. They're not even connected to each other with, there are no smartphones, and they're not even connected to one another with stupid phones at this point. So they need a copier for their flyers. He has to go down to the local printing shop, and he has to spend money on producing flyers and posters to take into his presentations and to distribute to people. And actually, he needs money to pay for airtime, because apparently more and more, as the crisis rolls along, we're not the only people who realize the power of the airwaves, by the way, because many good ministers and people from churches and local officials, as well as I'm quite sure some serious snake oil salesmen, are paying money to get on the air to tell people whatever they want to tell them. So basically anybody who can afford to pay money to a local radio station will get on the airwaves, and there isn't really any editorial control about what they're going to say on the airwaves. So Aaron needs to pay money to get on the airwaves, and when we get into the country, this is a conversation that we will be having with local radio stations as part of our building their capacity and ability to address the situation, that really asking people to pay for airtime isn't cool and isn't always in the public interest. It's a problem that we find frequently in Africa, and we have various ways of addressing it. We can often support the cost of the airwaves in order to pass it down to the community, and then help the radio station understand the balance of information that they should be bringing to their community, so that they can exercise some choice about who they have on their airwaves, and they are not handicapped by the cost of that kind of thing. So that's the story from Aaron, and happy to follow up with any questions on that. I just thought it was probably worth mentioning speaking about the border to which Aaron is so close, and that is the same border where the Ebola came from Guinea in the first place, we do have concerns about, well, as does everybody. I mean, in Nigeria there have been a couple of cases, and it's for the time being apparently contained there. But Central African Republic is most definitely cause for concern. Internews has a long-running project there in Central African Republic, where, and I will hand over to Ian to tell you a little bit about the concerns around that.
Yes, this started actually with an Ebola outbreak in the Democratic Republic of Congo, DRC, in the province of Equateur, which is in the north. This is a different strain of Ebola from the one in West Africa. Ebola was first identified in Congo. It's named after a river in Congo. That's where it's got its name from. There was an outbreak in Equatoria province, which has currently, I think there have been about 70 cases and 35 deaths, but it's in a very remote area, and it had not spread a lot. But of course, as soon as that happened, there was a lot of concern. And Bangui, the capital of Central African Republic, is on the other side of the Ubangi River from Equateur, the part of Congo where the outbreak was. So, and people cross the river, and we talked about porous borders before. This is a river. People cross in canoes, and there's a lot of traffic. So people in Bangui started to get very worried about this because, well, for a start, the war that has been going on in there has completely destroyed the state. The health infrastructure is terrible. There is not even a single quarantine ward in the country, and people didn't know anything about Ebola. We have a program there working with a local partner. We produce a daily newsletter of general information and humanitarian information, daily radio programs, and actually with the benefit of our expertise and the work that we've been doing in West Africa, we immediately plugged into their programming some information about Ebola. So we're also doing preventive work. At another Internews project, we have 50 community radio stations in the Democratic Republic of Congo that we work with. We've also helped them with information about Ebola. This is all preventive, but preventive, precautionary, what if is also a very important part should there be an outbreak. Fortunately, in CAR, there have been no confirmed cases to date. Do we have any questions out there? Because we've been talking a lot. Not a lot of time left. If people out there have questions, we'd be really happy to answer.
Well, thank you all. We do have a couple of questions on our message board that I will direct to the group here. The first one comes from Tiffany, and she says, since you work so closely with local journalists, what do you think has been a lesson learned for them on how to deal with this kind of crisis in the future?
Yeah, good question. I think the interesting thing is we do general journalism training as well. One of the important things that you learn in like lesson 1 of journalism is the importance of factually accurate, balanced, cross-checked information. That's part of general journalism training. And I think that the combination of reinforcing that message with local journalists, with the actual specific content to do with Ebola, has also helped them to understand that there are new and better ways of communicating about it, that they have the knowledge to be interactive with their communities, and that they can also take a much more proactive role. Because some of them who had been working, particularly in Guinea, where there is a network of what they call Radio Réal in Guinea, which is in lots of places, but it's very much also, it's a state-run radio, and they're very used to having messages, instructions, content coming down from the top and telling the people what to do. This is not necessarily bad, right, if it's health education, but the idea that you need to get out there and talk to people and see what they have to say about it and what they want to know about it has, I know from our work in Guinea and from other places, it's given them like a new dimension to approaching journalism as such. And of course, doing that, it happens to be Ebola, but that can have huge advantages in terms of how they deal with all kinds of information flows.
Great, thank you, Ian. I'll just address a couple of more questions that we have, and thanks again to everybody for their participation. Bridget says, you referenced the logistical difficulty of getting around to reach people in their communities, and in this case, are there other ways a crisis like this one is different than what you do in the wake of, like, let's say, a typhoon, an earthquake, or another disaster?
Alison, I think that was for you.
Yes, I think probably one of the interesting things about this is that the communities, for instance, I'll just use as an example again, Erin in Nimba County in Liberia. Communities can be isolated, they can even be quarantined off completely, but the mobile and internet access isn't terrible, which is quite different from some other situations, for instance, during tsunami after Haiti in the Philippines. I mean, when the actual so much destruction of infrastructure and towers go down and that sort of thing. So this is one tiny little bright side, is that people can actually be reached remotely. It means that if we work with journalists in the central hub in the capital city, we are able to disseminate the programs that they produce to their networks of other radio stations around the country through the internet over sound file. Whereas sometimes in Haiti, for instance, I think we burned programs onto discs and drove them around on motorbikes to deliver them to faraway radio stations. So working remotely obviously isn't the best, but in that sense, it is good to be able to reach these communities, you know, that to be able to reach them by remote, and we will certainly be doing that. I mean, having said that, we will be looking as soon as possible to see how far we can reach. As I said, Liberia isn't a very big country. It really just depends on the nature of the quarantine. In Guinea, we have these two centers which are very far apart, and one has to drive across the country between one office and the other, and that was happening, I mean, until the security situation deteriorated there, because, of course, civil unrest is also an aspect of the situation which can complicate things. And the hostility of communities themselves is something that can complicate things. And this is one of these freaky aspects that we have been seeing, is that communities have set upon health workers and set upon journalists, and simply because they don't have the information to understand, you know, who are these people who are coming to their doorsteps? Are they bringing the disease? How can they deal with them? And so there's just this response of, you know, trying to not have any contact with outsiders whatsoever. So this is again an aspect that can be dealt with by greater dissemination of information. But yes, we will work with them remotely until we can reach them in person.
Could I just add, we talked a lot about radio, which is a key medium in these countries, but what Alison just said is important. Where there are mobile phone networks, there's a terrific amount of interactive things that you can do, and we're exploring that, as are many humanitarian agencies and others in a lot of countries, as a medium which is complementary to radio and is becoming increasingly important.
Yeah.
Great, thank you. Okay, one last question for the group. We have one coming in from Laura Bernstein, and she asked, and I think we touched on this a little bit during the Hangout, but she asked specifically in West Africa, and it may differ from country to country, who are the major information brokers? Are they religious leaders, teachers, doctors, journalists? What kind of trends are you seeing there?
I think it's all of those people, and you really, in any given community, have to, I would say, dig down into the roots and find out who the most respected, but not just the most respected, the most reliable people are. Interesting to see how religion plays in this. Alison mentioned earlier that Aaron in Liberia is housed in the Methodist Church. It is a group who are working very closely with a church organization which is really doing a fantastic job to give people better information. In other places in the same country, in Liberia, there are preachers of various religions going around saying Ebola is punishment from God. The only thing you can do is pray and be better, and then maybe you will survive. So that's just an example that you can't generalize. In some places, governments themselves are deeply mistrusted, and messages coming out of them will tend to be not believed. I was told in one place that people, because we always emphasize working in local languages, local accents, being really close to the people, and I think it's very important to do that. And somebody said to me, actually, when people hear messages in English from an international NGO, they know it's kind of serious stuff, so they listen to that, and the people who understand it properly will explain in the local language to somebody else. We also know cases where it is completely the opposite, and where the fact that the messenger is coming in and is not from the local community, but is maybe someone from North America or Europe, is mistrusted because of that, and all the rumors that Alison was talking about earlier, like this is a plot to kill us all, so let's kill the messenger. So I think it is all of the kind of people that were talked about in the question, but that is the real importance of local knowledge, that the answer is not going to be the same everywhere, but you do indeed absolutely have to identify those people and work with them. They are absolutely key.
Thank you, Ian. And I realize, Matt, we didn't get to hear from you, and we're running out of time, unfortunately. But I just wanted to pass this off to you, Matt, if you had any final comments. I know a lot of folks on this call are interested in the work that you and your colleagues are doing in CAR. So if there's any comments, final comments from you, Matt, I think we don't have any further questions.
Well, I kind of lost you there for a second, but I think one thing I'd like to touch upon that both Ian and Alison mentioned was the subject of trust. A lot of these rural communities, they live in very isolated areas. They don't get a lot of access to the government. They don't trust their governments. They don't trust international organizations. And so one thing we really try and do is work with the community and try and build up the capacity of the people who are trusted within the community, the local journalists. And so the messages get fed through people that are trusted. We've seen attacks in Guinea. We've seen, these awareness campaigns haven't gone as successfully as people would have liked. And I think the major issue is trust there. So I think that's one thing we really try and focus on here at Internews. And it's not easy, but I think we're trying to learn from our experience and from the experience of others. But it seems like with Aaron and some people in Guinea, we're making a difference and able to access these communities that otherwise wouldn't have access.
Thank you, Matt. So I will pass this off to Alison and Ian. Do you have any final thoughts before we sign off here?
I'd just like to add one thing which we haven't touched on. We don't really have time to explore it, but there is a freedom of expression issue because, of course, many governments and local authorities, like in any crisis situation, want to control information. And a Liberian government recently said nobody can report on Ebola without having a permit to report on Ebola. And I think it's been very important for us to dialogue with these people. And what Matt was just saying about local trust, in Nzerekore there's a local health committee, and our local trainer, he goes to that committee, and they have meetings every day about Ebola. And at one stage they decided, oh, nobody can broadcast anything about Ebola unless it's the official statement that is coming from the regional health authority. And our journalist explained to them that this was not the way of maintaining trust with the population, and that it was very important that we should be reporting, hearing different voices, and not just having a kind of totalitarian, unilateral message of what the authorities wanted to tell us. And he actually persuaded the local committee that yes, indeed, our approach was better, and they wouldn't do that. So that's another example of the threats to citizen engagement and people really being involved in the information process rather than it being restricted and controlled. But also the role that the local trust we were describing could actually play in modifying that tendency to be control freakish about our information. I just wanted to add this issue because it could grow as an issue. Alison?
I don't really have anything to add. I think it's great that you touched on that point. Thanks, Ian. I just wanted to thank everybody who's on the call for your support to date. We are continuing to post our stories and our updates on our website. If you want to keep an eye on what we're up to, the next couple of weeks are going to see us actually put a team on the ground in Monrovia. We do have a trainer in Sierra Leone who has conducted trainings there, who is actually working with local journalists in Freetown every day on their coverage of the situation, and we hope to be able to support him with additional staff soon. And although the Guinea operation is pretty robust, obviously this situation, we can always use a bit of extra support there, more hands into the central media hubs. So stay tuned, check out the website, and thanks for joining us today. We really appreciate your support then, now, and in the future. And thanks, Amanda, and Ian, and Matt.
Yeah, thank you to all of our presenters, and thanks for participating. We'll see you next time.